The key thing with random program is that it's there as a deterrent for the workforce, and to make sure that your site or your office is as safe as possible. So if you are operating either as normal or as a reduced workforce, I think it's key that your random program is still being maintained. It might need a few changes. So if you are running a smaller workforce, then you could look at the percentages of people you're testing, or even the number of people you're testing, or the frequency. But yeah, in terms of your random program, I think if your business is operating, the risk is still there. So a random program is key. It will come back to your policy, but in theory, anybody that's working for you, whether they're at home, in the office, working remotely, should be covered under your policy. I think the main consideration, and it might be something that if you have a particular case at the moment, it'd be best to give us a call and talk about it. But it will just be around the logistics of getting the person from home to an area where they can be tested. Either that's to your site or to a clinic location, but it might require some logistics to organise. But in theory, yes, anybody that works for you, they can be tested under your drug and alcohol policy. Yeah, so from the COVID outbreak, we did look at our risk assessments and carry out a full review. That's something that's reviewed on a monthly basis by our Health and Safety Committee as well. But in theory, we made some key changes around sort of social distance, making sure there's appropriate space within the testing area, and also while we move around the area. We've made sure that all our technicians have full PPE. And also we ask for any donors and any managers to also wear a mask around the testing area. Also, we've made some key changes just around the process. So things like the donor being able to hold the breathalyzer while they provide a sample. And also just little things like allowing them to complete the paperwork while we step back away from the table, and little things like that, just to maintain that safe distance throughout the process. Yeah, so we wear a face mask. In terms of spec, it's the highest level of protection, just below a kind of full ventilation mask. We also wear a full apron, gloves, and make sure that between every test, the full area is sanitized. Yes, so the process providing a breath sample is effectively just like breathing into the device. There's no sort of excess breath that is produced, or any sort of heavy exhalation. The other thing as well is that we make sure when the donor is providing the test that they're not facing either our technician or anybody else that may be present. So yes, it is a safe method.